tax coffers are filled regularly by the duties on booze and cigarettes. But leaving liquor aside for one moment, as the tobacco ban's been in court today, could the income received by tobacco taxes balance out the cost of smoking to our healthcare sector and the economy? Dr. Sharon Nyatsanza is the Communications Manager for the National Council Against Smoking. She joins us now. Dr. Nyatsanza, good evening to you. The case was brought today by the tobacco industry. Government is obviously opposing them. They want the ban to be reinstated. I presume you agree with government the ban should stay in place for the moment.
So yes, at the National Council Against Smoking, we agree with government that the temporary ban on cigarettes should stay in place for the moment.
One of the big legal questions, of course, is about the link, whether it's alleged or not, whether it's real or not, between COVID-19 and people who smoke. The tobacco industry obviously claims that there is no link between people who smoke and what happens if they catch COVID-19. What evidence do you have that there is a link?
So, before we get into the evidence in the context of COVID-19, it has always been proven beyond reasonable doubt that there's a link between tobacco use and respiratory, damage. So, one of the key things in the context of COVID-19 is to have optimal lung function. So, we have COVID-19, which is a respiratory illness which attacks the lungs, and obviously, it's a new pandemic, so evidence is still growing, but evidence which is currently, which currently has been published to date shows that people who actually use tobacco are actually more likely to experience severe COVID-19 outcomes. They're more likely to have severe symptoms, meaning they're more likely to progress into the more serious stages of the disease. Evidence is also showing that they are more likely to require ventilators and ICU. So there is a link between the use of tobacco products, people who use tobacco products, and with COVID-19 symptoms.
Dr. Nyatsanza, the tobacco lobby has said in public, and I realize that they're paid to say this, they say that there is no link. I presume, are there studies that prove this? And I fully accept what you say, that we're still in the early phases of this pandemic. Are there studies that can be presented to the court to prove this link?
Yes, they are. They actually, so far we have more than 5 studies which actually proves that there is a link between the use of tobacco products and worse COVID-19 symptoms. And these studies have been peer reviewed, meaning they're also credible. So we have studies from the New Journal of England, and we also have studies from what we call the TDC, Tobacco Disease Control Journal, and we also have Chinese studies at the moment. So we do have studies that can be presented before the court to actually prove that there is a link between COVID-19 and worse there is a link between worse COVID-19 symptoms and tobacco use.
There's a much bigger question, a more general question about money, tobacco in our society. Now, again, the tobacco lobby will talk a lot about the income that tobacco brings. Of course, it's heavily taxed. If you're paying under 40 Rand for a packet of tobacco, for a packet of 20 cigarettes, then you know you're buying an illegal one, because roughly the taxes are around 20 Rand on each packet. The World Health Organization says 8 million people around the world every year die from tobacco. Is there a quantifiable amount? Do we know how much smoking costs us in terms of healthcare, the number of people who die and the strain they put on our healthcare system in normal times?
So right now, at this moment, we have, an estimate figure from the Tobacco Atlas. And again, this is already outdated. This was done in 2015, 2016. And it shows that South Africa loses 59 billion Rand each year from the healthcare costs and from the morbidity, which actually results from the use of tobacco. So studies have always shown, not only locally but even internationally, that the cost of tobacco to the economy, to the society, to the environment outweighs any benefit that industry itself actually brings. So in South Africa, currently we get about 14 billion Rand in tax revenues from the tobacco industry each year. And again, you can compare 14 billion versus 59 billion. This almost more than times 3, the benefit versus the cost actually it causes to the economy.